Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
A quick note before we start. This deep dive, grounded in the research and instructional work of Dr. Michael Jones, was crafted with generative AI tools to support accessibility and clarity. Welcome back to the deep dive. Today, we're really plunging into something critical for mental health pros right now. How do we actually master, not just sort of adapt to, the world of telemental health?
Yeah, it's moving so fast.
Exactly. So our mission today is to unpack the training, the certifications that are really changing how we define competence in this virtual space, helping professionals stay relevant, ethical, and, well, effective.
And it's fascinating, isn't it? Because telemental health, it's not just a side thing anymore.
Not at all.
It's really become a primary way we deliver services. It's fundamentally changing mental health care.
Right.
Which means, our old ways of thinking about professional development, how we learn and grow, they're just, well, they're not quite cutting it anymore.
So those traditional CE models, they're falling short. What's missing exactly when we're talking about something as dynamic as telemental health?
Well, the complexity is just, it's on another level. It really demands these specialized approaches. We're talking about things like situated learning.
Situated learning. Okay.
Yeah, it's not just passively soaking up info. It's about learning through real, authentic telemental health experiences.
Like actually doing it.
Exactly.
Right.
Engaging in a live video visit, maybe working with a virtual team, handling a remote crisis. Zakur and some colleagues talked about this back in 2021, describing these environments where you're actively developing skills by doing, not just reading about them. And this often involves something called legitimate peripheral participation.
That sounds academic. What does it mean in practice?
Think of it like an apprenticeship almost. A trainee might start by just observing virtual sessions, then maybe co-facilitating, and then eventually leading them.
Okay. So step by step, but in the actual virtual setting.
Precisely. Building competence gradually within that real-world context.
That makes a lot more sense. It's like, learning to swim by getting in the pool, not just reading the manual.
Yeah.
So if this kind of hands-on situated learning is key, how do professionals, show that they've actually got this specific competence? Is there a standard way, a certification?
Yes, absolutely there is. The Board Certified-TeleMental Health Credential, the BC-TMH, that's a really structured response to this exact need.
BC-TMH, okay.
It's a specialty credential from the NBCC, the National Board for Certified Counselors, and it specifically validates that a counselor is competent in delivering telemental health services.
So it's more than just showing up for a workshop.
Oh, much more.
Yeah.
You need documented training, you need supervised telemental health experience, and you have to pass a pretty comprehensive exam.
Wow. Okay, so it's rigorous. It really signifies something.
It does, and it lines up really closely with the NBCC Code of Ethics, standards 1 through 3 specifically, about competency and responsibility, and also the KC-REP 2024 standards. Remember, that's KCREP.
KCREP, got it.
Those standards on lifelong learning. Plus, NBCC standards 91 through 105, which are all about technology competence. But what really makes the BC-TMH stand out is its sharp focus on the therapeutic relationship when it's mediated by technology.
That's interesting. So how does that translate?
It means you need to be proficient in things like virtual assessment techniques, which can be different. How you meticulously manage digital privacy, a huge concern.
Huge.
And adapting crisis intervention protocols for when you're not in the same room. It acknowledges that this requires specific, specialized skills, way beyond traditional practice. It's a clear signal to clients, employers, peers, that you've really committed to a recognized standard.
That distinction feels so important, which brings up another, maybe even more urgent question. Technology changes so fast.
Yeah.
How do you stop these hard-earned skills from becoming, obsolete almost immediately? That sounds like skill decay.
That's a really vital point.
Yeah.
And yes, skill decay. It's basically the deterioration of your tech competencies over time if you don't practice or get exposure.
Right. Use it or lose it, basically.
Kind of. But here's the interesting twist. Research by Arthur and Day suggests this decay is actually more pronounced for the simpler tech tasks in telemental health. compared to the complex clinical skills.
Wait, really? The simple stuff fades faster. That seems backwards.
It does seem a bit counterintuitive, right? But think about it. You might learn the basics of a platform, setting up a call, sharing your screen. But if you don't do it constantly, or the platform updates its interface.
You forget the steps, or the buttons move.
Exactly. Whereas your core clinical skills, like CBT techniques, they're more deeply embedded, less tied to a specific button layout.
Okay, that makes sense. So what are the implications then? Especially with tech evolving constantly.
Well, the platforms are constantly evolving. Suggs and colleagues found, just in 2022, that how competent a counselor feels with tech is directly linked to how much exposure and familiarity they have.
So feeling confident means using it regularly.
Pretty much, which underscores that CE programs really need to provide regular, hands-on experience with the current tools, not just theory. You can't just learn a platform once and be done. You need that continuous, maybe even brief interaction with the latest versions, even for those seemingly minor things like managing chat features or breakout rooms.
Okay, so if our skills are constantly under threat from decay, what are the solutions? What does cutting-edge, innovative training look like to build up that resilience?
We're seeing some really exciting developments. One big area is virtual reality training, VR.
VR, like headsets and everything.
Exactly. Clay and colleagues explored this in 2024. VR creates these incredibly immersive but safe and controlled environments.
Safe spaces to practice.
Right. You can practice tricky telemental health communication, specific clinical skills through really realistic scenarios, maybe dealing with a client with complex issues or navigating an ethical gray area.
Wow.
And you get immediate feedback, all before you're doing it live with a real person.
That sounds incredibly valuable, a low-stakes way to really hone skills.
It really is. And alongside VR, we're also seeing a lot of promise with virtual patient simulators.
Simulators. Like flight simulators, but for therapy?
Sort of. Lee and colleagues looked at this in 2020. These tools use realistic scenarios, sometimes with AI-driven patients, to help you practice specific micro skills.
Like active listening.
Exactly. Or empathetic responses. And you get immediate, specific feedback. This fits perfectly with that K-CREP emphasis on experiential learning. It lets you do focused practice again and again.
Okay, so these tech tools are helping us learn the tech skills. That makes sense. But what about connecting this individual learning to the wider field? Professional organizations and all that?
That's crucial too. Sustainable development isn't just about individual learning. It really involves active engagement with professional organizations.
Right.
KCAP Standard 8.6 actually highlights the importance of building these specialized communities of practice around telemental health.
Communities of practice, so sharing knowledge.
Yes, and it's vital as the field matures. Being part of these groups gives you access to the latest research, evolving best practices, peer consultation, which is huge.
Yeah, talking to colleagues who get it.
Absolutely. And these connections often open doors for career growth too.
Yeah.
Supervision roles, leadership, advanced practice in telemental health.
Okay.
Plus, this engagement helps you build your professional development portfolio, which isn't just a folder of certificates, right?
No.
It should be a dynamic, living collection of evidence showing how your competence is developing over time, tracking your progress towards certification and beyond.
A living resume of expertise. I like that. But whenever we talk technology and sensitive care, ethics have to be front and center. Maintaining competence feels like a core ethical duty here.
Oh, absolutely. It's not optional. The ACA Code of Ethics, Section 892B, explicitly requires counselors to maintain competence. That definitely includes technology now. And as we mentioned, the NBCC standards 91 to 105 directly address tech competence. These are mandates, not suggestions.
Right.
And there's another really important ethical layer here, digital equity. Mohammed wrote about this in 2023.
Digital equity, what does that mean in this context?
It's the principle that all mental health professionals should have access to the technology training they need. But it also means ensuring our competence doesn't create barriers for clients.
So it's about access for professionals and clients.
Exactly. We need to think, does the platform I use work for everyone? Or does it exclude people with limited tech access or literacy? We have an ethical duty to understand these limitations and even be competent in alternative ways to deliver services if needed.
That's such a critical point. It's not just our skills, but how they impact accessibility for everyone. Okay, so pulling this all together, How does a professional actually build an effective, sustainable CE plan in this landscape? What are the practical steps?
Well, good planning means weaving together different competency areas, tech skills, clinical skills, ethics, while keeping that core therapeutic focus.
Right.
Pelosi and her team, back in 2022, suggested things like standalone learning modules, maybe covering virtual care basics, cultural awareness in virtual settings, collaborating with other professionals remotely.
Okay, specific modules.
Yeah, but these shouldn't just be tacked on. They need to be woven into a personalized plan that meets regulatory needs, but also your own career goals.
Tailored to the individual.
Right. And a truly sustainable plan needs regular self-assessment of your tech skills, chances for peer consultation, and, importantly, structured reflection
Reflection on what, specifically?
on how you're actually integrating these virtual care skills into your practice. The goal isn't just ticking boxes for CE hours.
No, it's about client outcomes.
Exactly. Ensuring these activities actually translate into better care for your clients.
That shift from compliance to client benefit is key. So, one last piece. How do we make sure all this training, all these CE efforts are actually working? What about quality improvement and evaluation?
Yeah, that's essential. We need continuous quality improvement guiding these programs. Pelosi and colleagues emphasized this again in 2023. Regular evaluation is crucial.
Evaluating the training itself.
Yes, assessing its effectiveness and making adjustments. Because telemental health is evolving so fast, the training needs to evolve too.
Makes sense.
An effective evaluation isn't just about knowledge quizzes.
Yeah.
It needs to look at practical skill application in virtual settings.
Seeing if people can actually do it.
Right. And getting good feedback is vital. Bolster and colleagues in 2022 highlighted that feedback in virtual care training needs to be timely, specific, and actionable.
Actionable, so you know exactly what to improve.
Precisely. That kind of feedback drives ongoing learning and helps develop truly competent telemental health practitioners. It advances the whole field, really.
Wow. What an incredibly thorough deep dive. We started asking what specialized training really means in telemental health today.
Yeah.
And I think we found it's not just an extra layer. It's a fundamental shift in how we approach professional growth, ethics, and ultimately delivering the best possible care in this virtual world. As you think about today's topic, consider these questions. 1, how might the concepts of skill decay or situated learning show up in your current telemental health practice or professional development goals? And 2, what specific steps might you want to take to ensure your technology competence aligns with ethical guidelines and promotes digital equity in your work moving forward?